Welcome back to the anti-cancer intervention video series. On this video we're going to talk about how to treat without any side effects. I think that's the most important thing, is to get to treatment without any side effects. Now I'd like to thank you very much. You guys are great. You put some comments, asked some questions. It's lovely to see that. I'd like to cover at least one of those comments that was made, and I'll get to that shortly. To remind you, what is my intention? My intention is to help you identify what's the cause of the cancer, because cancer is only a symptom. But also what's important is to know what to do about it. These brilliant ideas, what to do about it if you know what the cause is. So this is what we're going to be doing for today, is to be able to identify how to treat without any side effects. So just as a recap, number one was saying the stomach must be acidic enough to be able to absorb all the nutrition. We know nutrition is vital, it's the building block of life. So your stomach must be acidic enough. Now, just for those that haven't tested their urine to see whether it's pink or not, it's going about, if you eat beetroot the afternoon, before the evening passes, you have to see that your urine has turned pink or not. If it has turned pink, you must know your stomach is not acidic enough. You need to up the amount of acidity. There's a treatment that we have to do with getting more acidity on it. You can also do symptomatic treatment with the stomach by having, like, for example, apple cider vinegar 30 minutes before every meal. That will just prepare the stomach, saying food's coming, so just get more acidic. We don't believe only in symptomatic treatment. We need to treat the origin, but at least you can step off and start doing something about the stomach not being acidic enough. Right, so just to remind you, the pH was going about, like a swimming pool, pH is going about acidity or more alkaline. Now your stomach has to be very acidic to be able to absorb, but your blood must be alkaline, and being alkaline is between 7.35 and 7.45. What manages that? The lungs and the kidneys. So if the stomach is not going to be acidic enough, the kidneys are going to take strain, because they're going to get, like, for example, that pink pigmentation of the beetroot. You're going to absorb that. One of the questions was saying, I thought the common thing is the immune system not working, and that's a failing of the immune system. That's why one gets cancer. I do agree, but I disagree slightly. Simply because that is a symptom. If your immune system is not working, it's a symptom of something else again. We have to get to the nitty-gritty. If you have got inflammation, that immune system is kept busy. So if we're not freeing up our immune system to go do the work correctly, they're not going to have a good environment. So we have to free it up by making sure the entire body is sorted. And the treatment must not go about the cancer only, or just the cause of it. We have to go saying, give your immune system the ability, because 83% is kept busy on inflammation, if you have that inflammation. Right, so I'd like to cover the part as well about the lymphatic system. Now, if you say this is your lymphatic system, and the lymph is where you take the toxins, or the body takes the toxins out of the tissue, the body tissue, into the bloodstream, goes through the spleen on the left. The spleen cleans as much as 2 million red blood cells per second. Hard worker. And this is all managed by the thymus gland. And these are the things that we have to look at. They are markers for cancer. But unfortunately, we did not give attention to the lymph. Now, if you talk about blood, there's about 5 liters of blood. Let's call it a gallon of blood within the body. But 10 liters, 2 gallons of lymph in the body. Now, that might be a shock to many people, because many people don't even know what is lymph. If you want to drain your lymph, you go to the beautician. They've got a lymph drainage massage. Don't you think if it's that much compared to the blood, it's supposed to stay within the medical fraternity? This is exactly what we need to give attention to. Now, only in 2012, and take note, only in 2012, not earlier, they'd done a test to see how important is the lymph compared to the blood. And the conclusion was just important as the blood. So it just shows you that we need to give attention to the lymph. That's one of our cancer markers. And once we start identifying these cancer markers, knowing what it is, and then saying, what can we do about it? We can make sure we don't get to cancer. We are fighting the origin. We're giving the body the ability to be able to fight the cancer without needing to sort out only the symptom. Right, so just a reminder, we spoke about the resonating frequency and being a unhealthy cell, the unhealthy lung cell, you'd see how that would be compared to the healthy cell. So the resonating frequency is utmost important, and then obviously you're anemic. If your blood is not absorbing enough oxygen, which means it's going about iron, your vitamin B6, making sure your vitamin C is correct, B7 as well, and the folic acid, because the folic acid is one of the building blocks of the hemoglobin, just as the B6. A tumor is not dangerous, it's not cancerous, unless it gets a brain. Once it gets a brain, then it's going to colonize. And this information comes from Dr. Rife, that he determined that once you put a virus within a tumor, it becomes malignant. And then the status changes from a tumor to cancer. And we need to make sure that our immune system stops that virus. So immune system is utmost important. So yes, earlier we said, don't agree it's all going about immune system. Yes, immune system is going to stop it. But then again, make sure that there's not inflammation. Because if there's inflammation, there's too much to be done with too little manpower. So that is the entire focus. But now let's talk about the treatment. So presently, you've got a choice of treatment like surgery, radiation, or systemic like hormone, chemo, or then targeted therapies. I'd like to introduce you to a new type of therapy. Well, it might be new to you, but it's not new to the world. Since 1930, Dr. Rife was treating with a specific treatment, which I'll introduce you to. He got 16 patients, terminal patients, already gone through chemo, already gone through radiation, and the human trial was approved by him, was approved only because he's allowed to take these patients that's gone through the chemo, gone through the radiation. Once medicine gave up, they said, right, you can try whatever you want to try. And 4 weeks later, all 16 patients survived the cancer. So this is the type of technology I'd like to introduce you to. Now you remember when we spoke about we have to work on the cause of cancer, but also what to do about it. And part of the what to do is for example, this video, is how did we get to that tumor, that bladder cancer disappearing within 2 minutes, specifically working on the resonating frequency. And I'd like to introduce you to the technology called focused ultrasound. I'm going to play a small video where the doctor explains, and not in fine detail, just overview how they can surgically destroy a tumor with only sound. Hear this.
And I hold in my hand the tissue mimicking phantom. It is made out of silicone. It is transparent, made just for you. So you see it's all intact, completely transparent, okay? I'll take you now to the acoustic lab. You see the phantom within the aquarium. This is a setup I put in the physics lab. On the right-hand side, you see an ultrasonic transducer. So the ultrasonic transducer emits basically an ultrasonic beam that focuses inside the phantom. Okay, when you hear the click, this is when the energy starts to emit, and you see a lesion formed inside the phantom. Okay, so everything around it is whole and intact. It's just a lesion formed inside. So think about this is in your brain. We need to reach a target inside the brain. We can do it without harming any tissue. So this is, I think, the first kosher Hippocratic surgical system. Okay, so let's talk a little bit about ultrasound, the force of ultrasound. You know all about imaging, right? Ultrasound imaging. And you know also about lithotripsy, right? Breaking kidney stones. But ultrasound can be shaped to be anything in between because it's a mechanical force. Basically, it's a force acting on a tissue that it transverses. So you can change the intensity, the frequency, the duration, the pulse shape of the ultrasound to create anything from an airbrush, to a hammer. Okay? And
from an airbrush to a hammer. When we want healthy cells, we have to use the airbrush. When we want to kill a cell like a cancer cell, we need the hammer. And this is where he says we can reshape that energy to be able to do whatever we want it to be done. Now, many companies are busy with the research and development with ultrasound as a treatment and not just identifying the imaging. We would like to do it as treatment. Now, there's more than $50 million going into the research and development on a yearly basis. So we know that many companies, more than 50 of them, are doing this. And it's not available to the mass public simply because we're talking about an energy remedy. And we need to re-educate our existing medical doctors to be able to prescribe this as a remedy, being energy remedy. And unfortunately, our doctors are not educated on energy remedy. So there's even like a pledge of $10 million to the foundation to help promote the use of ultrasound, the focus ultrasound. Let's take a closer look at how a tumor can be destroyed with the sound. Now you'll see there's a tumor there, microtumors all over on the slide. And once we switch on, we see how they disintegrate. So the tumor breaks up and starts scattering. It's to destroy the entire colony of the tumor. And that is where using the hammer. We don't want to use the airbrush because we don't want to soothe it. We want to kill it off. And that is without any side effects. Is that the type of technology you would like to use fighting your cancer, making sure that you do not get cancer? This is the type of technology I'd like to introduce you to. So the next video you're going to be tuning into is how to get access to this treatment, because it's not available to the mass public yet because our doctors are not prescribing it. And you can get access right here on the next video. Thank you for joining, and please fill in some comments below because it's very important for me to know what you're thinking. Thank you very much for joining. Bye-bye.